Good evening, everyone. We'll get started in just a minute as we see people are filing in from the waiting room. Thank you all so much for joining us here this evening. I'll just delay a little bit longer because I see folks filing in right now. Good evening once again, and thank you all so much for being here this evening to join the UCI School of Social Sciences in a conversation about the economic impact of COVID-19. My name is Bill Maurer. I'm the Dean of the School of Social Sciences, and I'm really delighted that we were able to put together this panel and host this evening's conversation, because we know that while we're all facing social distancing and stay-at-home orders, we're also very concerned about the economic impact of this crisis. I'd like to make a special thank you to members of the School of Social Sciences Dean's Leadership Society who are here in force this evening and supporting the school. We very much appreciate your support during this difficult time. So I just wanted to give you that shout out. And again, thank you so much for being here. We know that these are suboptimal conditions for many people. Folks have screaming kids in the background and are juggling work and home in a confined space without being able to, do the basic things of walking around and going to the beach and going to the gym and so forth. So we really appreciate your being here with us tonight. Tonight's panel on the economic impact of COVID-19 has been organized by the Center for Population Inequality and Policy, which is a new research center in the School of Social Sciences focused on advancing research on the socioeconomic factors that impact inequality. This interdisciplinary center brings together researchers from public health, education, the social and natural sciences to study exactly the kinds of complex issues that we're all facing, from epidemiological issues to labor market shocks to the policy demands that they place upon us. Tonight, we'll be focusing mainly on the economic side of things. Now, more than 800 people have registered for this webinar, so it seems like we've hit a nerve in this subject that's on the top of everybody's minds. With that, I'd like to turn things over to our moderator, Distinguished Professor of Economics and Co-Director of the Center for Population Inequality and Policy, Professor David Neumark. Professor Neumark.
Thanks, Bill. Let me thank you all for joining us. I think this is going to be a very interesting discussion. We're going to, as the title suggests, kind of look at things at the national level, but also take it down to the local level. I think both are of interest to much of our audience. I'm going to quickly introduce the speakers and then tell you how we're going to do this. I told my co-speakers that I have a guy who plays the bagpipe at 6:30 in front of his house every night during the quarantine. So if you hear that in the background, I'm not in Scotland, just in San Francisco. So the following speakers are lined up. Gary Richardson is a professor in economics at UCI. He was a former historian of the Federal Reserve System, and he'll discuss challenges to the banking sector and the likely impacts of Fed policy. Eric Swanson, also a professor of economics. He was previously a senior economist at the Federal Reserve Board in Washington, and then a senior research advisor to Fed President Janet Yellen at San Francisco Federal Reserve Bank. He'll discuss actions by the Fed to stabilize financial market disruptions, focus on the macroeconomic consequences of the shutdown and some of the trade-offs between economic mortality costs of the shutdown versus disease. Chris Schwarz is an associate professor of finance at UCI also, and directs the Center for Investment, Wealth, and Management at the Mirage School of Business. He will discuss projected local and national economic impact and how the federal stimulus might affect it. And then we'll switch away from the academics. Arturo Gonzalez is the Director of Advocacy and Research at Facebook. He previously worked at Visa, the Federal Reserve Board, and was prior to that on the faculty at the University of Arizona. Has a PhD in economics from UC Santa Barbara. And he'll discuss what Facebook is learning about impacts on small businesses. Scott Connella is the market president for Union Bank's commercial banking group in Southern California. He's a UCI graduate, I believe the only one on the panel, class of 81 with a degree in economics. He'll discuss the impact on and reaction from middle market Southern California businesses, the effects of accommodative monetary policy and fiscal stimulus on these businesses, what the recovery might look like, and how the way we do business might change. And finally, Lucy Dunn is president and CEO of the Orange County Business Council. Her career includes practice of law, land entitlement and development, state director of housing, state transportation commissioner. Lucy will give us a look at what's happening on the ground in Orange County, as well as what is going on with regard to policy advocacy at both the state and federal level in preparation for, quote unquote, reopening the economy. So we're going to keep this short and snappy. Each panelist will have 5 minutes to present. We'll open it up to a very brief responses among the panelists for about 10 minutes, and then we'll have about 20 minutes of Q&A. I think most of you know how to send questions via chat. There are likely going to be far more than we can get to with all the participants we have. So we will be kind of curating and combining them to try to hit on the key economic themes people are asking about. So with that said, I'll turn it over to Gary.
Okay, so I'm gonna unmute and make sure you can hear me. And then I wanna show a few slides because I'm an academic and we love PowerPoint. So the shocks in the banking market have been really large and rapid. I'm gonna show you 2 graphs and tell you what they mean. The first looks at total assets in the banking system basically over the last year. And what you see is that total assets have been rising extremely rapidly in the last 2 months in large commercial banks in the United States. Let's see, my screen is just moving. And sorry, looks like my screen just shifted. But so the largest commercial banks in the US have been growing extremely rapidly, actually at an unprecedented pace. In part, this is because firms that had lines of credit at these banks about 2 months ago started drawing out as much credit as they can, trying to get the credit while they could before these credit lines got cut. And that's about half of the growth in banks is firms drawing on credit. The other half is depositors shifting out of shadow banks. So investors or firms who had money parked in financial institutions that weren't large commercial banks are moving their money to large commercial banks to benefit from the insurance protections through the FDIC and the implicit insurance that the federal government gives to funds in these large banks. And that kind of suggests there's going to be problems in lots of the financial system because there's a big run of people getting out of other financial institutions and going where it's safe. A second graph looks at the credit spread. So this is the credit spread that I plotted is the difference between the interest rate available to consumers on 30-year fixed rate mortgages and then the 10-year treasury rate. So the US government is kind of targeting the 10-year treasury rate, trying to bring that down. It's trying to get that rate down to 0, hoping to transmit these low rates to firms and consumers. That's not occurring really right now because the credit spread has been going up very rapidly. Also kind of at an unprecedented rate, and that's suggesting, and the last time we saw the credit spread riding this quickly was in the financial crisis a decade ago. This is suggesting that there's problems in the financial markets like fears of defaults on newly extended credit that are limiting the transmission of these low policy rates to the rest of the economy. Now, the Federal Reserve has acted really quickly to try to help the banks. It's pulled every policy lever that it has, lowering, allowing banks to access their reserves, lowering interest rates. It's also set it up 11 new special programs, and there's more, it'll roll out more soon. These programs really have 3 types. One are a set of programs that allow the central bank to purchase assets, which is going to do to stabilize financial markets. They're also trying to buttress commercial bank balance sheets and strengthen those. And there's a new set of programs called Main Street programs, which are basically funding loans through commercial banks direct to small and medium businesses. And the Fed has rolled those out. For now, I think the banking system it's safe, right? There's problems, but these are the types of problems we've seen, the Fed has seen before. But really, everything depends on how long this crisis lasts. If the economy gets back to fully functioning in a couple of weeks or a month, right, the banks are going to be able to weather this storm. If the crisis persists, there's really big problems going to arise for commercial banks, and then we're going to have to ask some serious questions, right? It's going to be banks, if the economy stays shut down for another 2 months, banks are going to suffer very large losses. The government's then going to have to see whether it should ask whether it should recapitalize the banks and bail out the banks. And should we keep bailing out the banks? This will be the second time in 10 years we've had to bail out the banking system, so maybe we don't have the right structure of the banking system. Other big questions that are coming up are going to be the independence in the Federal Reserve. The Federal Reserve is working really closely now with the US Treasury, probably more closely than it has with the Treasury since World War II. And it's not clear the Fed will get its independence back, and we got to talk about how valuable the independence of the central bank is. Also, international cooperation among central banks seems to be going okay now, but as we've seen in the last 10 years, and we've seen in similar events in the past, this kind of international cooperation that underpins the international financial system is fragile. And in the current political environment, it doesn't seem like we're working that well. Our government is working that well with its foreign counterparts. And so we might have problems in the international financial system that arise if the crisis persists. Okay, so that's
Thank you.
Yep.
All right, thanks very much, Gary. And now we'll turn it over to Eric Swanson.
Sorry, I had to unmute myself. Thank you very much, David. I worked at the Federal Reserve for many years, so I'll be happy to answer any questions people have on that. However, by now it's very clear that the Fed's dramatic actions did successfully stabilize the financial markets. They lowered interest rates almost immediately back down to zero. They increased liquidity in the financial markets dramatically by buying hundreds of billions of dollars of Treasury securities and other government-backed securities. Really, they sort of flexed their financial muscle and showed, the Fed showed its sort of unlimited ability to increase liquidity in a crisis, and largely succeeded in stabilizing the financial market. So really what I wanted to talk about for the rest of my brief time is the costs and the benefits of these lockdown policies. So hopefully you can all see my slides now. And so I'm going to talk a little bit about benefits and costs of lockdowns. Okay, the obvious benefits, the ones everyone knows about, are the COVID deaths are going to be reduced and the hospital system will not be overrun. There are other benefits as well. Flu deaths, traffic deaths are reduced, crime is lower, pollution is lower. Okay, let's turn to the costs. Child abuse is up. We don't have very good data on this. We do see a few newspaper articles on this. Some people like Angelina Jolie have been trying to raise people's awareness of this issue. The data that we do have suggests that it's there and it's a real problem. We have more data on domestic abuse. That's up significantly as well. That's another serious cost of these policies. There's a national hotline in the US for substance abuse and mental health. Calls to that hotline are up by a factor of 10 since before the crisis. So we see a lot of problems on the mental health and substance abuse horizon. There are 50 million children who have now been kicked out of school. About half of those children, roughly 26 million, are on free or subsidized meal plans at school, and they are no longer getting those meal plans. And there's 20 million people have already lost their jobs. There's another 10 million more job losses coming in the next few weeks. There's a tendency in the media to think that we can sort of offset that with unemployment insurance or a government check. The problem is economists have shown that when people lose their jobs, they have lower wages for life. Okay, so it's not just a 2-month, a 3-month, a 6-month issue. People tend to have 10% lower wages for the rest of their lives. Okay, in addition, there's research that shows that if you lose your job in a serious recession, your life expectancy is reduced by 1 to 1.5 years. Okay, and probably that's due to things like opiates and other drug addiction. But there's mortality consequences of these job losses as well that can't be offset with unemployment insurance. So the points I'm trying to make here are that the costs of these lockdown policies are large. They're astronomically large. The epidemiology models that are being used by the healthcare professionals essentially ignore completely the costs of these lockdowns. And as a society, we really need a more serious, informed discussion, weighing the benefits of the lockdowns against the costs. Okay, in the media, the discussion has been very, very superficial. It would be nice to consider these issues much more seriously. Excuse me. Economists, when they do these kinds of benefit cost analysis, they would use things like the value of a statistical life or the value of a quality adjusted life year. I don't have time to go into how people would come up with estimates of those, but if you look on Wikipedia, there's some articles about how do economists sort of try to measure what society seems to place on these kinds of benefits versus costs. And the final point I'll make on this slide is that benefits are the benefits of the lockdowns are likely overstated. For instance, population density explains most of the differences across states, not whether they lock down sooner or later. I'll show you a graph of that on the next slide. The coronavirus is here for good. So the benefits we're talking about are often temporary. I mean, most of us are going to end up catching this thing sooner or later anyway. So you do have to keep that in mind. And remember also, most of the benefits accrue to the elderly who do have fewer quality adjusted life years. Most of the costs are borne by the young who have a lot of life years ahead of them. This does raise difficult benefit cost and ethical issues, like how do you want to value the lives of the elderly against the lives of the young, and you know, what kind of trade-offs do you want to make there? But these are exactly the discussions that we as a society should be having, okay? Because these are the issues we face right now. I mentioned population density is the primary driver of infection rates. This is a scatter plot of all 50 states. On the horizontal axis, I have population per square mile in each of these states. And on the vertical axis, I have the coronavirus infection rate, or coronavirus cases per 1 million people, okay? New Jersey is the most densely populated state in the US, followed by Rhode Island, by Massachusetts, Connecticut, then Maryland and Delaware. And these densely populated states are also the ones that tend to have the highest infection rates. I did exclude New York from this graph just because New York itself is such an outlier. And the New York metropolitan area is an outlier in two ways. It's an outlier in terms of population density. It is way off the chart in population density, and it is way off the chart in the infection rate, okay? If you were to exclude the New York metro area, the rest of New York would look something like Pennsylvania. We'd be kind of right in line with the rest of this chart. I'll also mention there's Louisiana. That's the Mardi Gras effect right there. And, you know, obviously we don't want to replicate the Mardi Gras effect. But if you look at states like New Jersey, Maryland, California, which locked down very early, you see they kind of lie right along the same line as everyone else. If you look at Florida, Texas, Arizona, which locked down very, very late, they're pretty much on the same line as everybody else. It's mostly just population density, not whether you lock down early or late, which is determining your infection rate. With the one caveat that the Mardi Gras effect was very bad, and we want to avoid that. So let's avoid the Mardi Gras effect, but other than that, let's try to relax these lockdowns a little. So my conclusions: lockdown should be gradually relaxed, starting immediately. Sparsely populated states and counties can be more aggressive in relaxing those lockdowns. Out here in the West, we can be more aggressive in relaxing them. Quarantining the elderly and the vulnerable should be a top priority. The benefits of locking down the elderly and the vulnerable are large. The costs of locking them down are relatively small. Returning children to school should be a high priority because the costs of locking down the children seem to be very large between the abuse and the subsidized meals that are being lost. And many European countries are doing exactly this. They seem to be doing the same calculations. Norway, Denmark, and Austria are reopening schools this week, despite having double or triple California's infection rate. So I'll stop there.
Okay, thank you very much, Eric. Go to Chris Schwarz, please.
Thank you very much for having me here, and thank you to all the participants for coming online and spending some time with us. So I'm going to talk a little bit about two things. The first thing I was going to talk about a little bit about when we can reopen. And so, there's this, kind of got this in my attention back in March 25th. So the New York Times posted this model where you could go in and change the number of lockout days. And you could see if we kind of stayed home 60 days, they were predicting 14 million cases of coronavirus. And one of my friends sent this to me, and I couldn't possibly figure out how they got to 14 million cases. And I guess I shouldn't have been surprised. I always have this expression that theorists are from Mars and empiricists, people like myself who use data to make predictions, are from Venus, and we just don't understand each other. And so at that point, I started getting the business of trying to figure out, how many cases do we have, and when we'd probably be able to reopen based on government policy. And so just to review where we are here in the US, this is our US case data. This is from coronatracking.com. They post their data every afternoon. Essentially, most of the US went to lockdown on March 20th. Like every other country, it took about 14 days for us to get us to our peak rate. And now we're kind of at this plateau period where we have, essentially around the same number of cases every day, and we'll be in this for a while. If you're trying to predict where we're going to go, again, if you looked at various countries around the world, it will look most like Italy. And so Italy's about 2 weeks ahead of us. So if you just graphed our data in the US versus Italy, it looks like this, which you can see pretty much mirrors each other. Again, we're off by about 14 days. And of course, the nice part about this is you have a bit of a crystal ball in the future to see what our caseload is going to look like in about 14 days, presuming this relationship continues to hold, which would put us to about 50% of peak cases around the end of the month. So that would be about 14 to 17,000 cases per day at the end of the month. If you want to use EU data for the whole EU, you'd end up at just about the same prediction as if you looked at Italy. All right, so just doing some math here. Again, I'm assuming that governors are not going to change their policy. Of course, that would admit that they're wrong, and I assume that that's difficult for them to do no matter what you think. So about 2 weeks to get to about 50% caseload at the end of April. Figure 2 or 3 more weeks to get us back down to a low number that people might be comfortable reopening with. Also gives times for the hospitals to clear out, which gives us kind of a late May opening here in the United States for really kind of reopening things. And I'm going to go ahead and I'm going to put Memorial Day out there just because I can't imagine we're going to open on May 22nd, so we can go have barbecues with all of our friends and be close together for a weekend. And so my guess is that's probably when stay at home at various places will happen. If we look here at California, of course, we're not going to reopen right away. Most places are not going to reopen right away, but this is from our governor this afternoon here in California. He laid out 6 criteria for us to reopen, and essentially, I just want to highlight 2 comments he made. That essentially one of the comments was that restaurants would probably have about half the number of tables that they had beforehand. People have masks and paper menus. And they also stated essentially any gathering of more than 100 people is going to be forbidden until there's either a vaccine or we have some kind of herd immunity, which we're not even close to. So there's this hard-hit German town, and they looked at the percentage of that population that had antivirals, basically antibodies for the coronavirus, and only about 15% did, which doesn't put us anywhere close to herd immunity. All right, so the basic idea here is that we're probably going to be closed for a while longer here. And even when we do reopen, we're going to be a very muted reopen. I mean, essentially, if you think about the places that are closed, the governor is talking about a 50% reopen rate at those places like movie theaters, restaurants, and so forth. I'm not sure how Disney World would do social distancing to reopen. All right, and so if we start looking about kind of the economy and what the recovery look like, I'm just looking at some old data here, and it's pretty noisy, but just to give you some expectation here or ideas. So this is the last 4 recessions. I don't have the current recession in here. And so what I did was I just started at time 0. So that's when the recession started. And then I looked how long it took for, say, the size of the economy in real terms to get back to where it was when the recession started. And of course, there's a lot of variation here depending on the recession. But if you do some quick math, it's about 21 months from start to end. The average recession is about 15 months. So it's about a 1.4x to get us to, back to where we were before. And so, of course, based on this very simple model, 1.4x times 4 months means that we'd be back to where we were in September 2020, which is what I think a lot of people thought when we got to the beginning. Of course, there is no way we'll be back in September 2020. So this is essentially the expectations about what's going to happen to GDP based on JP Morgan and Goldman Sachs and some other forecasts. We could be looking at aggregate shock of minus 12% here by June. Again, we can only partially reopen based on what the governor stated, for example, in California, which of course is a huge part of the US economy. And then of course, it's going to be a very slow recovery until we get some kind of vaccine. So the idea we're going to bounce back and have this very V-shaped recovery seems very far-fetched to me. If we look at unemployment, so that's a little bit more homogeneous here. So if you look at the last 4 recessions, so I did the change in unemployment. It's inverted here just to give you an idea. Again, you can see here on average, it's been about 71 months to go from start to finish. So about 6 times the length of the recession. So again, that implies that we have employment back to where it was in March of 2020 or February 2022, excuse me. But you can see here, there's no way that's going to happen. So again, those are the same 4 recessions, but we're talking about unemployment here in the US that's going to hit between 20 and 30%. And so you can see that's 2 to 4 times deeper than what we had in the last financial crisis. And it's going to take an incredibly long time to recover from that. The only good news I have for you is on average, if you look at the stock market, it takes about 3 years to recover from start to finish. So if you do out the math here, 4-month recession times 2.4x would get us to December 2020. Of course, the stock market since the beginning of March is only down about 4% right now. So at least our portfolios aren't hurt quite as poorly as they would be based on historical data. All right, so just in summary here, I think we're looking at probably data that lets the governors reopen us near the end of May. But in my opinion, it's going to be a very long and bumpy recovery. This will be the deepest recession since the Great Depression. We can only partially reopen until we have a vaccine. We might have another stay-at-home later if cases start spiking. And in fact, Google traffic says that we're already stopping stay-at-home somewhat. We're going to have state budget destruction pretty much based on reduction of revenues and increase the cost of these social programs. And of course, all of us will have a higher level of indebtedness when we're done.
Thank you, Chris. That was cheery. We'll hand it off to Arturo Gonzalez now.
Thanks, David. So we at Facebook are aware that businesses are experiencing significant disruptions resulting from the global outbreak of COVID-19. And this is especially more so the case for small businesses. We're trying and striving to keep informed about the kinds of problems that small businesses are facing so that we can even provide small resources, especially for those businesses that need it most during this time. We're hearing about financial challenges, especially difficulties that small businesses are experiencing with things like keeping their workforce going strong, the cost of paying for rent and leases, connecting with customers and reaching out to customers, and just covering their overall operational costs. But at the same time, we're hearing about some of the actions that businesses are taking successfully to deal with some of the challenges. But first of all, let's talk about some of these things that business can take today to try to stem some of these challenges. First, it's important to keep safe and informed by following credible official sources, such as from the Centers for Disease Control and Prevention, the World Health Organization, or your local government health departments. That way, you're able to respond quickly to changes that can affect businesses or the customers that they serve. Second, we're seeing that businesses more so than ever need to stay in touch with their customers. They need to proactively share important information, such as through email, their website, a page on Facebook if they have one, Instagram account if they have it. That way, you're able to stay connected. Things like keeping updated your hours, updating your info about when you're open for services and changes to the services, whether you're temporarily closed or how you're dealing with face-to-face interactions. Also, we're seeing that posting creative content makes a difference. That increases engagement between businesses and their customers. And so it definitely helps drive some of the opportunities to engage with customers and that lead to more sales. Another action that we're seeing businesses take is to bring more of their business online to the extent possible. So some products and services that can be brought online are obviously able to deal with some of the implications of the quarantines and the shutdowns and the reduction in the ability for customers to be out and just browse. Things like hosting live sessions on social channels, whether it's Facebook or other social means, we've observed that those have been able to lead to greater response from customers and hopefully potentially the bottom line for businesses. Of course, it's important that you cancel any planned events that might be as a consequence of the outbreak. As we said, depending on businesses, it's possible to change the business model to accommodate delivery, curbside, pickup, or takeout. And so we're trying to stay informed by reaching out to businesses through surveys and other engagements. And we're doing this globally. We're doing this locally as well. We want to be hyper localized so that businesses can deal more effectively with the current conditions of how commerce is being undertaken. We're trying to learn from businesses themselves about what are the best practices that we can then share with other businesses. And we put some of these best practices available for other businesses on our website so that they can take advantage of these best practices themselves to the extent possible. So these resources, we hope will be able to make an impact at the small business community. We also realize, though, that the financial challenges are there. And so we're trying to be more proactive in making businesses make them be more connected to their customers. For example, through digital gift cards. You might have heard about these stories on NPR or some other sources where people have been buying gift cards to help out their local businesses. And so we're participating with that effort by helping businesses come on and be registered. So we definitely want to have a larger group of businesses that are available for consumers who want to help out. Facebook is also trying to be more a part of the greater effort to help businesses by having a $100 million grant program that hopes to support businesses with the expenses that we mentioned or other expenses that we've experienced. And the grant program is now online, and the eligibility is there for people to take a look at. So we're hoping that through a combination of having taken out or undertaking surveys, having outreach efforts to small businesses, we're able to then take some of that learning, share it with the wider community, and be able to get businesses up and running as soon as possible or to the best extent possible. Thanks.
Very good, thank you. Scott Connella, please.
Good evening. I appreciate the opportunity to share some of my personal observations on how COVID is affecting middle market businesses in the Southern California area. I'll spend a few minutes discussing how businesses have been impacted, how monetary easing and fiscal stimulus is helping, and some thoughts on recovery. In terms of business impact, the suddenness, the severity, and the variability all stand out. Related to suddenness, a couple of data points. The first COVID test that was positive in California was on January 25th. In less than 60 days later, on March 19th, there was a statewide shelter-in-place order, which effectively shut down many companies. During the same period, the stock market lost about a third of its value in a period of a little over 1 month. And when you compare this to the Great Recession, the market was down 20% in 10 months. So the suddenness of this is really unprecedented. When you look at severity, some businesses experienced immediate revenue drops of 90 to 100%, including dine-in restaurants, live entertainment, conventions, and manufacturers of non-essential products. Most business owners that we deal with have contingency plans for slowdowns and recessions, but they're typically looking at a 30 to 40% reduction in revenues. There really aren't any companies that have contingency plans for shutdowns when there's not a recovery date in sight. So the severity is extreme when you look at middle market businesses. The last thing I wanted to touch on as far as impact is the variability, because it's really noteworthy in this particular case. There are significant differences in how businesses are affected depending on whether they're deemed essential or not. If you look at the food industry as an example, supermarkets have had minimal impact, where restaurants have had maximum impact. If you start going down the supply chain and you look at, for example, take a seafood processor that's processing seafood for a supermarket, really has not seen a lot of change. And in fact, if anything, their business may have increased. But if you're a seafood supplier or processor and you're doing business with a restaurant, your business may have totally stopped. You look at healthcare products and services, and you see the same type of thing. If it's required care, there's a minimal effect from this. Routine care, there's a moderate effect as people are postponing office visits that they might do. If it is elective procedures, there's a maximum impact we're seeing. Another area I would touch on is just if you're a manufacturer or distributor of products to big box retailers like Costco or Walmart or Target or Home Depot, they fared better than a lot of the other businesses because those stores continue to be operating and they continue to have most of the product supply you typically see. The last area I wanted to touch on as far as impact is professional services. So that would be your accounting firms, your legal firms, financial services, engineering. Most of those types of businesses have done a good job moving to a remote environment. And so while the volume of their business may be down, they're continuing to operate. I wanted to spend just a second talking about the aggressive government action in response to the downturn. So first, in terms of monetary easing, if you look back in August of 2019, the government started to reduce the rates, and there have been 5 rate cuts since August. 2 of those rate cuts coming in March, which totaled 1.5% in March. If you look at the federal funds rate today, it's at 25 basis points, which is a historic low. Normally, this would be a stimulus for business investment, but with the uncertain future, we're not seeing a lot of business investment going on at this time. It does lower the borrowing costs for many of the businesses, and so that certainly helps for those who have a lot of debt. There's multiple stimulus programs that have been mentioned already. The one that's getting the most attention right now is the PPP program or P3 program. That's administered by the Small Business Administration. You can get a loan of up to $10 million for 2 years. The notable thing about the program is there's debt forgiveness for payroll expense. So since that program has been launched, there's been an incredible response. It launched on April 3rd. The SBA has seen 791,000 applications in the first 8 days of the program. That compares to 60,000 applications for all of 2019. So the biggest challenge here is all the businesses, or not all businesses, but a lot of businesses are applying for this program. It's really how fast can we move the volume through the system and get the money out to the businesses. Finally, I want to spend just a minute on recovery and kind of what thoughts I see there. First of all, I have tremendous confidence in the resilience and the resourcefulness of the business owners in Southern California, and I have no doubt that they will adapt to this new environment and succeed. That being said, I think it's going to be critical for business and consumer confidence to be restored before we start to see a comeback. I expect, as several of the speakers have mentioned, the recovery is going to be very gradual, as this is going to be the severity of this downturn is being etched in business owners' minds. I do think there were some pre-COVID business trends that are going to accelerate, and we're already seeing that. You know, one is there was a trend towards less office space, and I think with the remote workforce and what's being done right now, I see that trend continuing. Clearly, there's going to be an increased use of digital channels for retail, and I think that's going to, certainly stay. And last, as we're doing right now, I think business travel is probably going to be reduced as people use video conferencing much more in their businesses. And with that, I'll pass it back to you, David.
Okay, thanks very much. And our last speaker will be Lucy Dunn, please.
Thank you all very, very much. My job here is to talk a little bit about reopening the economy and some thoughts from the local, state, federal perspective, some discussion on some policy debates that are kind of interesting going on right now. And I begin with thinking back to the week of March 16th when the County of Orange at the local level had issued an order to basically shut down the county. And the business community got very concerned about that, went into their elected officials who were not consulted by the health officer of the County of Orange, and within one day reopened the county, only for the governor the next day to shut down the state, following the efforts of the Bay Area, having previously shut down their 6 counties the week earlier. So it is interesting at a local level that our health officers seem to be ruling our worlds right now. And you see that in all of the conversation, and rightfully so. Even business will concede that you cannot have a livelihood without a life. And we did not know where this was all going to head, but for watching what was happening in other countries. It is interesting, the discussion as well on the state level. You've seen the governor roll out today, as was already presented by Chris, the governor's 6-point plan to reopen the economy. And yet the points really concerned how to deal with health effects, in particular testing, contact tracing, preventing infection of people who are at risk, healthcare systems to avoid surges, developing therapeutics, where are those vaccines, et cetera, and also to be able to determine when to reinstate certain measures such as stay-at-home orders. That is fascinating because it's all preparing for the health issues. Again, though, connecting with the local level, the business communities and economic development offices in cities are already starting to put together their wish lists for reopening. If our restaurants are fewer in number in tables, how far apart do those tables need to be? Do we all need to be wearing masks in public? What does this reopening look like? And that wish list needs to get put together, and frankly, probably needs to be determined uniquely to the region. Orange County was less hit. Physical distancing does seem to work. And so how do we manage that at the local level? At the state level, again, it's interesting. In the 6-point plan, the governor also announced the formation of an economic revitalization team, but he didn't name who was on the team. And the business community tends to be a little bit nervous about that because our governor and administrations past and present have tended to focus on economic academics, which is great, but they also need to have some real world business people in the room. And so you'll see them step up and ask for some folks that actually have CEO experience. The governor as well has led through executive order as the legislature is gone. And so you've seen executive orders from what should constitute essential businesses. His agenda has been to increase housing supply in the state. Housing and homelessness still the #1 issues of our residents. And but also deferring income taxes, sales taxes, not property taxes. Cities wanted those property taxes in, so executive orders did not include that. Watch as well, we saw a little foreshadowing, legislature's gone, but a little foreshadowing in Los Angeles when city councils were looking at how to enhance paid leave for workers. Workers' rights, unions' rights became a big focus, and the business community in LA had to mobilize very strongly to push back on that. Mayor Garcetti did not support those things, remembering that you can't, when an employer is on his or her back, you can't not remember that there has to be employment in order to have workers' rights and union rights taken care of. So watch that as foreshadowing when the legislature comes back. This doesn't tend to be a legislature that is pro-business in its focus. And so there needs to be business engagement to take a look at this. At the federal level, I give them credit. You know, if you can say without argument that the only organization with a lower approval rating than Caltrans is Congress, at least to their credit, Congress has tried to work in a bipartisan way, getting out the funding. But as it gets closer to elections, that's going to get tougher. In fact, right now they're in disaster relief. They're not even in economic stimulus, which we saw certainly in the Great Recession and others. It's about getting checks into people's bank accounts so they can, you know, put food on the table for those incredibly impacted. So trust in the feds is low and continues to fall. Non-Washington leaders are trusted the most. They're offering hard truths. They built their credibility early. Governors are forming alliances with states. You saw it on the East Coast. You've seen it with Gavin Newsom on the West Coast. And frankly, even our CEOs at the local level have led efforts to physically distance, moving their businesses off of locations early. And the nonprofit community offered a strong safety net backstops to help. So local leaders seem to be less framed by hyper-partisanship and the craziness that is our media right now. So keep a look at the state level in that regard. The big policy debates that are going on are fascinating. You have demands and requests and pleading of the business community to put a pause on new regulations that are coming up. We've got a minimum wage increase coming in January. You have approvals of transportation plans that are being asked to come today, and yet none of these plans have included an analysis of what a pandemic world looks like. When you, as someone had earlier mentioned, when you look at density in city and declining transit ridership, what does that look like in a state that has very strong climate change goals, asking us to get out of our cars? Is in fact one of the reasons that California wasn't hard hit is that we have a single car culture and we were in our cars and not on transit. I don't have the answer to that, but those are the things that need to be analyzed. Other policy debates, including housing issues, where we're trying to intensify development in urban areas in order to make transit work. But also our climate change rules don't allow for easy development. And you've seen nothing done in executive orders to alleviate the ability to build housing in the state, notwithstanding it being a top issue for our governor. Another great policy debate is the examining freedoms trade-offs. Are we gonna make a COVID vaccine mandatory? Are we going to use cell phones to contact and trace folks? Are we going to be limiting deceptive speech on platforms? Are we going to impose national quarantines? Watch these trade-offs of freedom, as healthcare tends to be the #1 issue. And what we do with those trade-offs and that debate is going to be really, really important. I want to end with some recommendations for leaders that I think this is from a great Washington group.
Lucy, I'm going to cut in. We have to wrap up very quickly.
Yes, very quickly. One quick 5 points. Have a good answer to how did you help during the great pandemic. Make sure you quantify what you did for your employees, customers, community, and nation. Leverage the opportunity to build a better business. We talked about teleworking tools and telehealth benefits. Have credible solutions for the new major challenge. What will grow employment, increase resiliency, or save money? How to prepare to engage reformers on the systemic failures that are starting to get exposed now. And think globally, act locally, as we tend to want to get away from a global economy. Business cannot. They are global companies that we're dealing with here. How does that tension, where you think globally and act locally, work for us? And that's it.
Thank you very much. I think what I'm going to do is actually jump in with a few questions based on kind of things I've been getting and what I've been, the conversation we've been having. And I'll kind of direct it to one person, but others, I think most of these questions, more than one will want to chip in. So the first question I'd like to ask, I'd like to go back to Chris for a moment, who talked about the likely length of the recovery. And I'm curious, what you think are potentially mitigating factors that might make what's happening now different from a recession where that was in some sense much more widespread, where there were declines in wealth, declines in housing prices. Is there reason for optimism that the sort of simply multiplying it by, length of recession and the like might lead to much quicker recovery because we haven't had the same damage to credit and wealth?
Sure. So, I mean, obviously, I think one of the things that's a positive is, generally speaking, the banking system, among other institutions, was in better shape going into this situation than, say, in 07, 08. So I think in theory, you have kind of a better bones, so to speak, if you think about the human body, than we had going into that particular recession. So I mean, that's going to be helpful. Like I said, I think the issue is just how quickly we're allowed to reopen. And so I think that's going to be the real question mark. And so the longer we go on, the more damage you do to the bones, right? So it's like we're not drinking our milk right now. And so you can go a month without drinking milk and you'll be okay, but 3 months without drinking milk, or 4 months, and then all of a sudden credit things. If you look at mortgage forbearance, for example, I mean, I think it's up huge the last month, and it's only going to get worse every month as we go on. So yeah, we're in good shape, and I mean, hopefully we can open soon, but that's really the question.
Anyone else care to weigh in on that? Eric or Gary in particular?
I mean, I'd agree with Chris. The major difference is that the banking system was much, much stronger coming into this than in the last recession. And so that is a positive relative to the last recession. The last recession was a very slow recovery. If the banking system is fundamentally sound, when there is evidence that when the financial system is good, that recoveries can bounce back more quickly. So we would think you'd be more likely to get that this time around.
I would say on the other side, there is might be more uncertainty about what's going to come down the road, right? We don't know whether this disease is going to go away or whether it's going to persist and have a big impact on longevity. And there's a lot of uncertainty about what jobs people are going to go back to. It may be that people don't want to eat out as often as they did in the past. Travel might go down. The cruise industry might really change. And so we might have millions of people around this country that don't have a job to go back to long run, and they got to get retrained and reskilled and shifted. So I think there are quick recoveries possible, but I think there's a lot of uncertainty out there, and we may be in for a much longer haul than we expect.
Yeah, Scott, let me put a kind of the same question, but add on to it to you. You're in the banking sector, so I'm curious about your take on the health of the banking sector. Also getting quite a few questions, which again pertain to perhaps the comparability between the two recessions as to likely impacts on housing markets and real estate prices.
First, as far as the banking sector itself, I couldn't agree more that the banking sector is much stronger than it was before the last downturn. And so I do expect, in terms of liquidity, the government has reacted very rapidly to the downturn and has really backstopped the banks with plenty of liquidity. And I think the rapid response is notable because in the recession, that did not happen rapidly. So I think those are all very, very positive. As far as the mortgage business I was reading today, I think banks have actually tightened up some of their underwriting standards. Some of the banks have. I was reading that earlier today. And I think, one risk I see is just when you start to have layoffs and unemployment starts to pick up, I think business owners are going to be cautious when things start improving, hiring those people back. That's what we typically see. And that's why I personally think it'll be a much more gradual recovery. I don't think there's going to be a moment where, on May 31st, everybody starts hiring back the people that have been laid off. So I just see a little more gradual recovery.
One quick thing too is you still have a supply constraint in this state in particular, which we have not made any dent in. Plus, it does appear that interest rates are going to stay low for a while. So that could help with affordability, even if the prices may not go down as much as you might think. Something to think about.
Question about, keep this one quick, but I'll ask you a follow-up question. One is about how businesses might access the grants. We'll keep that quick because that's advertising. But I'm also curious if you could say anything about what you know or what you hear about what tech companies, who of course have a lot of information about us and where we are and what we're doing, are thinking about offering to monitoring of health to help county health officials and the like improve our monitoring and testing and tracing.
Yeah, I'll begin with that last question first by mentioning that last week it was announced that Facebook was partnering with Carnegie Mellon to take advantage of some of the infrastructure that we have in place. As I mentioned, we try to survey businesses. We are trying to take advantage of that by trying to find out what the health status of individuals are by asking them what their symptoms are from a health perspective. On the data side, it's a tough question because we're not collecting data that is, I think, useful for us for this purposes or for other purposes. The data collection sometimes is inferred through cookies or through other means that doesn't give you a lot of micro data in the way that economists think of data, like from surveys or from like from the census. And so that data is not really that, at the end of the day, valuable. We have, there are companies like Waze that follow traffic patterns, Google that follow traffic patterns. So you're able to learn location information from other sources. The cell phone companies provide that information. So I think there's information that's useful here and there when you can combine it. And I think government is best placed to take advantage of that, to see what is the overall impact for communities. And then briefly with regards to your question about the grants program, you could find that through, just going to your favorite search engine, or through on Facebook by entering $100 million small business grant, and that will direct you to the Boost page in the Facebook page where you'll see the application, and you can begin the application process pretty straightforward that way.
Great. Another question we've gotten is, which I imagine I've seen it asked in many different ways in media and policy debate. Why does the Fed continue to support banks instead of individuals? And Gary, maybe I'll give you the first crack at that.
Well, by law, the Fed has to support banks. The Fed have the power to make direct loans to individuals from 1932 to 2008, or to 2010, when the Dodd-Frank Act took away that power. So right now, the Federal Reserve can only really make loans to financial institutions and then direct the funds through financial institutions to others. That's just the way our society is set up, the central bank. We did have the power. In 1932, the Federal Reserve System was given the power to make loans in unusual and exigent circumstances to any individual, partnership, or corporation in the United States, as long as the Board of Governors approved the loan. And so Congress thought it was.
What about the logic? Sorry, what about the logic aside from the law, the logic of the policy?
So the logic of the original kind of thinking is that the central bank should only work with banks under some clear rules to make sure that we didn't take that enormous economic power it has and influence the distribution of wealth, favor some people over others. In 1932, Congress said, we might need this emergency power in there. The Federal Reserve officers, they're like officers in the military. When you get with officers in the military, if you're a Navy captain out at sea, we tell you, you're out at sea, if there's a hurricane, you figure out how to deal with it, you get back to port, then afterwards we'll just make a decision about what you did, whether it was right or wrong. So they gave enormous power to the Federal Reserve, but then they took that away after 2008 because Congress felt that the Fed acted too much to favor certain businesses and it influenced the distribution of wealth, and they didn't want that. So we took that power away.
Eric, I'd like a question to you. You talked about, essentially arguing for more perspective on the costs and not just the benefits. Right?
Yeah.
Have you made any attempt to sort of ask, are we completely out of line if we think about costs and benefits in terms of what we're doing? You use the word astronomical on one side. Or are we, at least for now, perhaps getting the balance partly right, recognizing, of course, that some of these steps, although you may dispute this, have reduced deaths?
So a lot of the cost versus benefit analysis depends on how big the benefits are, and there's a lot of uncertainty about how many deaths are we going to save, right? And the original projections were maybe if we didn't do anything, you might have millions upon millions of deaths, and so then of course you have to follow these kinds of policies to try to prevent that outcome. Now that we're looking more at a trade-off of maybe 10,000, 20,000, 30,000, those kinds of numbers, you have to start weighing that against the 50 million children, the 20 million lost jobs. And then the balance, it's not clear we're really striking the right balance. I would think that given that the outlook has improved so much in the last 4 weeks, that we really ought to be sort of relaxing these policies, these lockdowns a little bit at the margin. I think we'd all be a lot happier if we just, I'm not saying go to Mardi Gras or anything, right? But let's open the hair salons, let's open maybe the mom and pop retail stores. Let's start with that. Make everybody wear a mask for a couple months, and then see how that goes.
Let me just clarify one point. I'll ask the question. Let you clarify just to make sure people understand. If you took the position that social distancing is why we might have 60 or 100 or or 120,000 deaths instead of a million, then the benefits may have been huge, even though we're not seeing the cost because the costs were reverting. But you're actually arguing, based on your density graph, that you're at least skeptical that the social distancing policies have made much difference.
Yeah, so it's really more about the lockdowns, right? So it seems like, most of these states, no matter whether they lock down early or late, have gotten, more or less the same kinds of results, okay? So, I mean, some of the states that lock down earlier are a little better off, but not a lot. It's not like California versus New Jersey, which is really just a population density issue rather than a lockdown issue. And so could we achieve the same results with just social distancing rather than a full-blown lockdown like we're doing right now? I think we could.
Lucy, a related question that I got from the audience member. Since you've been, I think, the closest to the policy discussions, what's the discussion about, and this relates to what Eric was just talking about, what's the discussion about how to do this, how to reopen at whatever speed in the really dense places, New York, San Francisco, much of New Jersey, et cetera? I know you're more plugged into California, but what are the options there, and what's the scope for doing it in reasonable time?
Well, again, it is more of leading by the healthcare officers. If the whole point is not to overwhelm the healthcare systems and make sure that there is enough beds for once things do start to open up, that you're going to see a surge because it's just natural. We don't have immunity to this disease. It's going to happen again. And so then do you slowly go back to, or quickly go back to, the physical distancing requirements, the masks in place? But that's part of the issue. It's pretty much an experiment. You saw that if you look at Korea and you look at New Zealand, those governments were much more followed by their people. There was much more respect for a total lockdown. Here, it's a little dicier. People do want their freedom and they want to get out there. So the issue for us in the more dense locations will be, I think, to experiment first with the less dense places where there's 1 or 2 cases, and then let that happen. And hopefully over time, we get the testing, we get the vaccines out, and it allows an easing in the more dense locations.
Thank you. 2 more questions, and I think we're gonna call it a night. I'm getting a list of questions on my other screen, and some of them, not surprisingly, are about the stock market. People who had 401ks, then had 201ks, and now they're back to 301ks. But I guess I'll put this question to Chris first. One form of the question is, when is a good time to get back in the equity markets? But a somewhat more substantive version, I think, which is also a little puzzling, is how do you explain the market coming back to a pretty strong level pretty quickly, or is that an incorrect perception of reality? Is the market, in your view, overly optimistic at this point, or not?
Well, if I knew that answer, I'd be running a hedge fund probably and not on the webinar. But, so I'll make a couple of comments. So one, we have a very famous expression in finance called "don't fight the Fed." That's step number 1. And the Fed has come in with an unprecedented amount of liquidity. They're buying pretty much every bond you can think of at this point, including high yield bonds, corporate, investment grade bonds, municipal bonds, treasury bonds. So they're pretty much buying everything you can possibly imagine on the fixed income side of the house. And so that's really kind of come in and added a lot of liquidity. So that would be the first point I would make. The second point I would make is, the probability of the stock market going up a month is 64%. The month after it goes up 64% of the time. It goes up 64% of the time after the market goes down. So pretty much the market truly is a random walk. And so, for long-term investors, I think it's always about making a plan and sticking with it. I think the market was much more attractive a few weeks ago than it is now. I'm a little bit surprised where the market is, I'll be honest with you, but I think a lot of the market right now is focused on looking at when cases peak, and they're using that as a signal about how long the recession will last. And of course, there's a discounted mechanism. So if it thinks we're going to be fine in 12 months, then it's going to be like, okay, it's just short-term pain. So, I'm not super surprised. We really had a huge, we went down an unprecedented speed when we went down, 30, 40% in 2 weeks, basically, or 3 weeks. But also remember, it's still a 25% move up from here to get back to where we were. So, you know, where we were in February. So, you know, it's a good time to buy. If you're, what I always tell people is, you know, if you're my age and the market's not up when you go to retire, you're not retiring anyway. And so, you know, I think probably if you're a long-term investor, you just stick to the plan that you have. Make sure you rebalance your portfolio if you haven't already, because you're probably way overweight in bonds. And just stick with the plan. I think you always need a plan and not be emotional, which is what people tend to do. I mean, don't sell at the bottom, which hopefully no one on the webinar did.
Yes, I agree with that. What I keep telling my kids. Last question, I'll start with Lucy, I think. You know, we've talked about reopening in terms of, you know, how far apart the tables will be and what the credit markets will be like and all. What are you hearing from business people about how they think the issue of reconnecting and renegotiating with their workers is going to go? Getting them back to work, if they're going to come back to the same places, if they're going to have disappeared to the sectors that are growing, and what kind of problems they're anticipating or what kind of solutions they're talking about.
Well, it's interesting because it's not so much I'm hearing from business leaders on this, but the fact that in a highly progressive state as California is, there are a lot of rules in place, even with governor's executive orders that require the rehiring, require that you bring back your workers if they're on furlough in a certain order, et cetera. Negotiations with their unions might be controlling the larger businesses. On the smaller businesses, the ones that have let folks go, and maybe mid-sized businesses, what I'm hearing, there's a lot of folks that might let an entire department go only because they want to retool and take advantage of CARES Act opportunities for them, lending, and rework their companies to be more nimble. We hired big, Orange County in particular. When you're looking at a 2.4% unemployment, we were fully employed. And so now maybe there were workers that you might not otherwise want. How do you do that and take advantage of this economy now to rethink? But for the most part, overwhelmingly, I see businesses want to take care of their workers. You look at a group like Disney, largest single site employer, they're having to furlough folks because there's no park to visit. And yet they're providing a year's worth of healthcare. They're still paying for education, even on furlough. And they're prepared to rehire when the park opens. And again, that's the nature of it. People will want to come back to visit Disneyland. They'll want to go to restaurants again. So I would be saying overwhelmingly, I'm seeing businesses really care about their workers, and particularly the ones that they are working from home, trying to make sure that not only do they have the professional support, but the personal support. I mean, how many of us are doing childcare and working from home at the same time, and frankly, working harder than we ever did in the office because you can't escape it when you're doing, 5 Zoom conferences a day. So I give them a lot of kudos, and I think that that's a really important point, is to be able to share that story and say how you helped your workers when this is all over.
Great. Well, I think that's a good note to end it on. We're a bit over an hour, and our attendees have started to trickle out a little bit. So I want to thank all the panelists for your really insightful comments. I want to thank the audience for joining, Dean Maurer for helping us host this, and our tech crew for helping make this happen without incident, which doesn't always happen on Zoom, I hear. So thanks very much, and good night, everybody.
Good night.
Thank you, David.
Thank you.
Good night and thank you.
Thank you.